Welcome to the Learnskin podcast with Dr. Raja and Dr. Hadar, where they discuss all things skin. Skin is fascinating because it affects us in so many ways, like our health, psychology, and how we connect with those around us. This podcast delves into the art and science of skincare. A short disclaimer before we get to the good stuff. Dr. Raja Sivamani and Dr. Hadar Lev-Tov are board-certified dermatologists. This podcast is meant for educational and informational purposes only. All opinions shared do not express the views of Learnskin. Neither this podcast nor any information contained within it are a substitute for professional care by a doctor or other qualified medical professional. This podcast does not constitute medical or other professional advice or services.
Hello, everyone, and welcome to the Learnskin podcast. My name is Hadar Lev-Tov, and welcome again to another episode. Today, we are in luck. We have a great practitioner with us, Dr. Payal Bhandari, who is a leading practitioner in integrative functional medicine. She's also the founder of one of the top integrative medical centers in the West Coast, the center called Advanced Health, located in San Francisco. Dr. Bhandari trained in family practice, also went to medical school in West Virginia, and then she decided to turn into integrative approaches to medicine. And now she specializes in treating patients with her strong background in nutrition, Ayurveda, and stress and sleep management. So, Dr. Bhandari, welcome.
Thank you for having me.
Yes, wonderful. And we wanted to have you here to talk to general practitioners, dermatologists, other practitioners from alternative practices, and maybe just some listeners on the street, because we have some topics that we want to cover relating to physician burnout. But before we get to that, maybe we can talk about what does it mean to be a doctor, because before we maybe define what it means to be burned out, we should understand what does it mean to be a doctor. So what does that mean to you?
The meaning of a doctor, if you were to look it up in Webster's dictionary, you're going to find many different definitions. A, it can be a learned or an authoritative teacher. B, it's a person who's earned one of the highest academic degrees, such as a PhD, or even an honorary doctorate by a university or college. C, it's a person who's skilled in the healing arts, such as a doctor, a dentist, a veterinarian, who holds an advanced degree and is licensed to practice. D, it's a medicine man, a person who has supernatural powers, who can heal illnesses and keep away evil spirits. It's a person who uses food as medicine to produce a desired effect, which restores, repairs, and fine-tunes a person, but avoids using tools which inflict harm. E, it's a doctor is all of the above. Some would say that decades or hundreds of years ago, people often thought of a doctor as a medicine man, a person who always healed, reversed disease, and only used tools that were for the best intention of the person. In today's world, though, some of us would actually say a medical doctor no longer uses tools that reverse and heal illnesses. But unfortunately, we now have an epidemic of chronic disease. We're no longer using tools which are derived from food, which is our original medicine. But instead, we've doctored synthetic chemicals in the form of pharmaceuticals as safe modalities to heal all. This new age medicine is often loaded with side effects that can harm people and cause long-term dependency, which unfortunately doesn't always cure the underlying problem. We also prescribe expensive diagnostic tests that may be associated with radiation or even invasive curative procedures that might placate symptoms, but unfortunately can cause harm. So the definition of a doctor, although it means many things to many of us, at the end it's about a person who really is learned, whose goals are aligned with the people that they are engaging with, and are really then creating a transformation. So I think all four of the definitions are true, but it's aligning with what we still believe and then shifting the way that we practice.
Yes, and I wanted to jump in and say I pick E, all of the above, but
Yes.
But then I realized that maybe it's not a test. But I'm such a trained doctor. We were trained and taking tests, you know. But thank you so much. I actually always say that doctors existed before medicine. We were there to help people before we even knew what to do. And my definition of a doctor is based on two major components. One is compassion, and the other one is skill. I think that if you care about people, if you want to help people, that's the primary fundamental emotion or a quality that you need to have as a person in order to practice medicine. And then, of course, you should develop a skill to help and build your experience. And for that, we have some more formal training and informal training. But I certainly think that you kind of broke it down for us really nicely and explained this. And I'm sure that most listeners here to our podcast would agree that we want to go beyond pharmaceuticals and try to help people in every facet of health that we can. And speaking of skills, by the way, it leads me to the next point that I wanted to talk to you about, which is what is the responsibility of a doctor? We mentioned skill, we mentioned compassion, you mentioned, some sort of training, achieving a high degree, being a teacher. So what is actually the responsibility that we have to our patients or maybe to society when we practice medicine?
Well, if you ask me, a doctor's responsibility is to listen and inspire hope. But if you ask others, everyone comes up with different answers. It could be to give people the right diagnoses and all the information they need so that patients can make free and informed decisions. But it isn't always believed that it's the doctor's obligation to produce positive outcomes. Some would say that a doctor's responsibility is to treat patients attentively, conscientiously, and to respect their confidentiality. Some would say that a doctor's responsibility is to prescribe the right medication, to inform them of the pros and cons of proposed tests, treatments, procedures, and to make sure that they follow up with patients in a timely manner. But I honestly think that our job is to inspire hope, because hope helps us to know what is this person experiencing, what is really going on a deeper cellular level, what is the right course of care, and that may be many different tools that we use, and that we are staying connected with these people. So the top, three options really, I think, embrace: if we inspire, we listen, we then transform. And that is our responsibility.
I love that you use the verb to inspire. I think it's such a challenge to do in medicine, yet it's so important to achieve, because it means that you are not only reaching an understanding with your patient, with the person in front of you as to what's going on in their lives, but you also leverage that to move forward into an action. So I love inspire. I love that use. Now, some of the cynicals who are listening to us, and they're out there, that say, hey, Dr. Bhandari, that's really cool. I would love to inspire every patient, but how do I do this in 10, 15 minutes managed care scenario?
So then they start with the limiting belief, because that's the perception that quantity of time is what drives outcomes. But in reality, it's the perception of time that defines quality. It doesn't take, a number of hours to say hello and connect with a person. It's the way that we do that. When we help take down barriers without making people feel rushed. 90+% of the work we do is how we actively listen. Because so much of what a person is saying is actually what they don't say. Because if you tap into all five senses, you'll know what they're really saying and what's going on. If you engage with them as a person instead of as an illness, you're truly you're listening and you're inspiring. And that's where you see people, they take their guard down and a lot of good things happen. You take away their fears. That does not take, an hour. It can be just the way we engage as human beings.
Absolutely. I agree wholeheartedly. And actually, I find, as one example, when you actually, I find in my clinic, when I talk to my patients, many times I will prescribe a regimen and say, hey, what do you think? Let's try to use this type of treatment, medication, what have you. And I see a look on their face. I see something in their eyes that tells me this is not going to happen for whatever reason. That is kind of the source of what we call compliance, maybe. And at that point, that's a decision point for doctors. And like you say, it's a split second, doesn't take much. You can either choose to ignore what you just saw. You got a gut feeling this is not going to work out. Or you can choose to smile and say, what's going on? Tell me. And I find whenever I choose to do that, only good stuff happens, right? We achieve that connection. I'm able to understand what is the barrier. And sometimes it's very simple. Doc, I cannot afford this. Doc, I cannot apply this cream to my back. I live alone, Those little things make a whole difference and actually lead to better outcomes. And I think you're right. It doesn't take much time to do. It just takes the act of listening. And I'm not going to blame computers and EMRs on this because I do think they play a significant role in achieving healthcare on a quality on a bigger scale. But certainly when we are engaged in the computer in front of us instead of the patient in front of us, it's harder to do. And we have to conscientiously make space in our visit time and in our brain to acknowledge the person in front of us. So thank you for reminding us. It does not take a lot of time. It's more about an attitude. I agree. And I wanted to now, maybe when we look at these things about the meaning of being a doctor and thinking about how to make things work in our clinic and taking responsibility to inspire our patients, I feel that recently, and it's not just me, it's been well established in the medical literature, there's an epidemic where physicians are not happy in their practice. The reports are just astonishing. Maybe 2/3 of physicians around the world suffer from a syndrome that is called physician burnout. It has various definitions, but certainly is sort of three components that seem to be emerging through the literature. One of emotional exhaustion, one of depersonalization, and sort of a diminished feeling that you can achieve your goals. It's even included now in the new ICD-11 definitions, and certainly an epidemic worldwide. We see physicians that take their own lives or have sudden death. It's really a tragedy. And I wonder, how do you make sense of that, and how do you think this happens to physicians?
Well, when a person enters the field of medicine, they choose it first for themselves. There's duties that they want to fulfill, which are aligned with their purpose and how the profession is going to best support their needs. So really, your first duty is to yourselves. You're the first patient. And then you can then have the duty to the people that you want to serve. But when we go through medicine, we are taught to be resilient by ignoring our emotional heart intelligence, which is our real brain. And we're told to only rely on our brain, which is the mediator between our gut instincts and our reaction. We're taught to never show self-doubt and to be all-knowing. And then over time, our heart intelligence, it learns this information. And then it communicates that we're impatient, scared, and we lack critical thinking. The thing is that if you try to keep fixing problems inside the box, we've kept coming up with very expensive solutions. And over the last 30 to 40 decades, we've just increased the physician-patient burnt out, financially, physically, and spiritually. So the story of physician burnout did not start like in the last 20 years. It's been going on for, at least 70 years. And so we kept coming up with these solutions. But in reality, we've helped feed the source where the problem started. And in the process, we're losing our soul. And the key is that when you start thinking outside the box, the answers are there. You really start to have meaning towards what you know feels right. It's not that complicated. It starts with first listening to your instincts and stop rationalizing that you have to be unhappy to keep going on. You just
Right.
have to find the courage to speak up. But there are really easy, sustainable solutions. And the real courage is, if you kind of stay in the systems, that takes a lot of guts because it's exhausting day in and day out. And you go in to work, you're unhappy, you're complaining, but you're not really spending any energy figuring out what to do. And now people are coming out into the industry and they're saying, well, how fast can I pay off my debt, make enough money, and then retire? Or they're saying, let me
Isn't
just
that
do
sad,
the bare
right?
minimum.
It's
I
really
mean, it's the
sad.
reality of, hey, I put in, a lot of time, I have a lot of debt, and I've chosen certain fields because I know what the financial, results are, but that's not turning out, right? And that's a big reason people chose certain professions, because you have to be practical. And
Right.
the thing is, they're also saying, well, this isn't what I thought it was going to be. And so
Right.
they're disheartened. But at the same time, we've also left a lot of those critical mentors that were around probably in the 70s and 80s. And most people have now, joined institutions where they don't have people who are saying, no, we can think outside the box. And so the answers are there, but it really starts with go back to where you started. Before you got jaded, you don't have to burn out, because burnout is when you lose patience with not listening. So you lose patience with your own self, and therefore you're losing patience with everything around, and that's burnt out. It's our own burnt out. And when you're in burnt out, or when you're walking that path, we're reactive. We're not really proactive.
No, I think you mentioned some really critical points, and I love, first of all, what you said about being your own patient. I think it all relates back to that idea when we all went into medical school or whatever medical training that we went into in the beginning, we had that spark, we had that golden nugget in our heart, in our gut, that told us we want to help people and this is how we want to do it. And we had some ideals. And then somewhere along the way, there was a disconnect. And I think maybe when we graduate for whatever terminal training that we have, perhaps one of the solutions is to find your own style of practice and how you connect patients, kind of connecting back to the themes that we mentioned before about the role of a doctor. And also, I really like what you mentioned about mentors. I think when I finished residency, one of the most important things for me was to find a real mentor, somebody who, not just one person, but a few people who can really guide me and show me the way into a career that I want to achieve at the end. I had this ideal of a career. So I think that is certainly lost probably, I would say in the private practice. I'm in an academic center, but in a private practice, that's probably lost. And I wonder, who can people turn to in big groups that don't have this sort of model of practice? But I want to ask you, how do you in your little kingdom handle the idea of burnout? What little things do you do in your daily practice that you think sort of keep the burnout away?
Well, I have to always remind myself, what's my purpose, right? If I go back to the fact that I basically want to just connect with people, it has to be based on quality, not quantity. It's about building lasting relationships in everyone that I meet, because I am truly grateful for every person that I get to encounter. I am not, the person that I am there to help them. They are doing as much, if not more, having a real impact on my life. And to do that, I have to think about what creates sustainability. Sustainability is about, this is a journey. I'm not on a race. So to be on a journey, I've got to enjoy this ride, and I've got to learn how to work smart and not work hard. So I've got to know that I'm investing in all aspects of my life, not just shafting some and saying I'll deal with it later. And those deal with me comes first. So that means I've got to make sure I have quality sleep. I have time to pace myself, to meditate, to really nurture how to have fun in life. Not to be extreme, but to find balance. so that you can show up for yourself. You can show up as a parent, a spouse, a daughter, a sister, a community member, because that's really what helps us connect with the people that we're caring for. And it has to do with also getting out of places of scarcity, right? And that can be our perception of, I need more time, I need more money, I need more and more of something. And I think it's checking in that scarcity always stems from somewhere. So you've got to have a long-term vision, and you got to kind of keep finding ways to create structure so you can keep reminding yourself that if you are driven by, intermittent gratification. So for example, in doctors, we love getting awards. We love accolades from colleagues, from the patient who brings us a gift, right? We want more of that. We're human beings. So we want to work harder. We might go above and beyond, and that's awesome. But be careful in the process of doing that. Did you show up for other things that are just important? Because our journey also defines our legacy. And our legacy is defined by really the feeling that we create in others. It's never by how much do we accomplish, how much money do we make, all of our accolades. At the end, when people build their legacy, it's always defined by how did you make me feel? And that's first, I got to check in with myself, because, hundreds of years from now, when one has passed and somebody is remembered, it was always defined by a feeling. So I check in pretty often. And when I'm uncomfortable, I got to check and understand why. Give yourself some time. So the idea of being on this like high volume way of cranking out hours and seeing lots of people, and you don't actually end up getting the returns on your investment. So to be successful, you have to align our purpose with being very business savvy, because that's when you actually always drive quality of care, quality of experience. And you have built sustainability that allows many opportunities to come your way and to open opportunities for others.
Thank you. That was really informative. Actually, I think I really liked what you said about finding a structure and how it leads to a balance, and kind of sit with yourself and think, what do I really want to achieve? Not just in my professional life, but also in my personal life, my relationships, and for myself. Like you mentioned before, I'm my own patient first. If it's some hobby that I really want to get done, or a language I want to learn, whatever it is that you want to do, to get that done first and set out time for yourself to have, and that's a key word you mentioned, in my opinion, is fun. To find the fun. Actually, kind of connecting to an earlier theme you mentioned about mentorship, I find that my most of my mentors, my senior mentors, when I always caught them doing a lot of things that were just fun. And I remember early in my career being puzzled, how does this work out? These people are so busy. They are very accomplished in their career, and so they have their itineraries is scheduled beyond belief, yet they find a lot of time to have a lot of fun. And I think if you find a way to include that into your life, whatever makes you happy, I think that's maybe one place to start with. So I think what we'll do is, at this point, I would like to stop and say, we want to talk more about this. Burnout is a huge problem. I think it's a problem even for dermatologists, which is perceived a more cush, quote unquote, practice. We certainly see that in dermatologists, and it's pervasive across the healthcare spectrum. So I want to invite our listeners to come listen to you talk about burnout and how they can maybe inspire themselves in their own clinics to achieve that structure and balance that will keep the burnout away. And I'm obviously referring to your very well-expected talk at the Integrative Dermatology Symposium that is coming up in October in San Diego, and I'm looking forward to hear more from you. And I want to thank you, Dr. Bhandari, for your time and your expertise.
Thank you.
Thank you for tuning into the Learnskin podcast with Dr. Raja and Dr. Hadar. We would like to take this moment to tell you about our upcoming second annual Integrative Dermatology Symposium to be held at the Coronado Island Marriott in San Diego, California. This program is an educational experience jam-packed with information, including case-based discussions and multiple perspectives on topics such as psoriasis, atopic dermatitis, diet and skin microbiome, cannabinoids, hair loss, traditional Chinese medicine, and much, much more. Go to www.integrativedermatologysymposium.com and register today. We look forward to seeing you there.